For me, it has been great. The unity, the teamwork is absolutely incredible. You wouldn't see that even in civilian jobs. So I've worked as a civil servant before. I worked in private sector and public sector. I haven't seen the teamwork that you get in the army. You will not find it anywhere else. That feeling of togetherness, that you will never leave someone behind regardless of their strengths or weaknesses. You're always together as a team. Whatever you're doing it for one and only reason, is the mission that you've been given. And everyone works together. There's no, backstabbing, or there is no one being left behind.
Yeah.
We are there to serve our country. We are here to work together for our community. And we will do anything to the best of our ability to deliver that.
Welcome to Empower Her, the podcast dedicated to empowering women with their health, wealth and well-being. Just before I get started, I have a quick request. Please consider following and sharing this podcast. Your support not only amplifies our reach, but also enables me to bring in more remarkable guests and empower more women. Have you ever contemplated the potential benefits of joining the Army? Does the term Army evoke any negative thoughts or perceptions for you? Join me in this truly inspirational talk with Manpreet MayCock, where we explore the transformative journey of joining the Army and unravel Manpreet's story from overcoming domestic abuse to finding empowerment in the military. In this enlightening conversation, we dispel misconceptions about Army life, discuss the valuable lessons it teaches, and highlight the myriad opportunities it offers. Join us on this impactful journey of strength, resilience and motivation, shedding light on the untapped potential for personal growth within unconventional paths.
Welcome to the Empower Her podcast. I'm super excited to talk to Manpreet MayCock. She is working in the Army. I'm so excited to find out about her story and what she is doing now. Manpreet, please could you introduce yourself and let us know about your story and your journey from what you were doing and to what you are doing now. That will be fantastic. Thank you so much.
Okay, thank you. Thank you, Shira, for having me on your podcast. So as you said, I'm Manpreet. I was born and brought up in India, in Delhi. I graduated and came over to UK through arranged marriage process. And that was around year 2000. And since then, I've been in UK. And I later on, in around 2010, joined the Army. Decided that's what I wanted to do. And I joined as a reservist. I also work within NHS at Guy's and St Thomas's Hospital in London.
Could you tell me a little bit about why you joined the Army? You came to the UK from India in 2000. And I know you've been on a bit of a journey, and that thought of going into the Army, I don't think many people, especially women, especially Asian women, would have that thought of, you know what, let me join the Army. Not really, I would never have thought of that as a career option for me at all. I suppose growing up for me, it wasn't really a thing anyway. It wasn't something that I knew about much, to be honest. And I still don't know much about the Army. So could you talk a little bit about why you joined and what that brings for you and what it brought for you?
Yeah, sure. So the reason I joined the Army was actually I was going through a rough time in my life. Through the arranged marriage, the marriage didn't work out for me, and I was at the lowest point in my life. And I really needed some help, and I needed some courage and strength. And if at that point somebody had said to me, you can get some courage tablets from somewhere, I would have probably taken them. Yeah. But that wasn't the option. There was no such thing as courage vaccine available. Otherwise, I would have taken that too. Yeah. And coming from the lowest point, going through domestic abuse in the marriage that I was in, I really needed a positive change in my life. And I thought, what could I possibly do to get that strength and do something different that is going to make me happy, give me courage, and give me the strength to deal with the day-to-day challenges that I was facing. after being homeless at one point. And one day I saw a poster of a woman carrying a rifle on. I was passing through a high street and I saw this poster and I was really struck by it. And I didn't realize that girls could actually join the army, and especially brown girls. I didn't think brown girls could join the army. So I had a number of questions in my head at that point. What are the height restrictions? What are the weight restrictions? Because I was quite underweight at the time. Coming from India, can I join? So I then decided I will go in and have a conversation with the recruitment office, which I did at the time, and everything else is past. I then joined. I didn't think anything more. There were a number of reservations as well as to how it's going to have an impact on me and my children, because I was looking after my children and had a full-time job. And some of my colleagues at work were really against when I told them about this, that I would like to join the army as a reservist. Especially one of the close friends said to me, "Are you stupid? Why don't you join a running club, or why don't you join a tennis club if you just want to do something different and get something positive in your life?" And I didn't think running was going to give me something. I enjoyed running, but it wasn't something that was going to help me combat the challenges I was going through. Besides everyone saying, don't do this, I went ahead and joined the army. I didn't tell anybody after that. And I think it's one of the best decisions I've made in my life.
Wow. So when you joined, what was that process like? And you talk about being a reservist. Can you explain a bit about that? Because a lot of people, including me, I have no idea what it's like to join the army. That's one thing, what it involves and what the options are once you join. Could you talk about that a bit more?
Yeah, sure. So when I joined, and even now the process is around, it depends whether you want to join as a regular, you want to join the regular army or as a reservist. So there are a number of options there. And then you want to join as a soldier or as an officer. Again, you have a choice there. You do your basic training, regardless of which path you're going to choose. And from that basic training, then you do your trade training. So, for example, as a reservist, I did my initial phase 1 training, which was around 4 to 5 weekends away. And then from there on, it was my phase 2 training, which was about the trade that I was going to take on. And it's quite similar in terms of the regular soldiers as well. Their training is more intense in relation to the number of time, the duration that they have to spend. So they will be there for around 14 weeks initially, and then 26 weeks on their trade training, is my understanding. But yeah, you're treated equally, and you learn some of the skill sets around survival, fieldcraft, first aid, weapon handling. You look after your health and well-being and your mental ability to deal with things, and yeah, your fitness level just shoots up.
Yeah, I can imagine, for sure. So when you say the basic training, what does that involve? I just want to know the detail a little bit about, because for me, I'm thinking, wow, that's going to be hard work, and you're going to be like put through all sorts of things. And have I got the strength and the ability to do that mentally and physically? Because that would be one of my big barriers that I would go through before thinking, is the army something I would want to even do or consider?
Okay. So if anybody's thinking about joining, I wouldn't say that you need to worry about it, because you're given a plan to work towards. So when I went in, I was told what the expectations were, and the assessment that you have to go through initially, which is your physical and your mental assessment. You spend like a weekend away, and they assess you on different aspects, and also how you work within a team. So there are a number of exercises that you will go through. And during that time, you're also given what the minimum standard is. And anyone can train towards it. You need about 4 to 8 weeks, depending on, how much time you have and how you want to get in. You just train for it and you simply just give it your best shot. And again, if you don't do so well first time, they will give you again progress plan. So you're never told this is the end of it. They will work with you depending on your willingness to learn and willingness to work hard. This is all about hard work. I wouldn't call it easy. I wouldn't call it impossible. Otherwise, I wouldn't be sitting here and talking.
Yeah, I know, because I think, when I first met you, we kind of clicked in the sense that, we're of same build. I'm quite short. I'm about 5 foot-ish, and we're quite petite. And when I saw you first in your army uniform, I was quite taken aback, and I thought, oh my God, wow, is she really in the army, or is that just what she's wearing? I wasn't sure initially. And then, when we had that conversation, I was, I definitely didn't envisage that. And because of the things that we see in the media or in movies as well, right? When you're watching stuff, you see all these big men and, women really like strong and fighting for it. And I guess we don't have that view. And it's great that you're here to represent, Asian women. That's one thing, brown women and women as well. And women of our build as well. That's another thing, right?
Yeah. I don't fit the stereotype of a typical soldier. You can say that for sure. Regardless of the build, it's about what you're gonna put in. It's all about your abilities and your willingness to do something. And again, like I said, working in a team, that's the key thing that we have to bring to the table. And working as a woman, a lot of women are not joining the army because, it's the stigma attached to it that is only for men is really outdated now. Women are joining. We would like more women to come forward and join, and especially South Asian and Black women, women from ethnic minorities. We would like to see more of them coming forward and see this as a career. And options that are available to you, regardless of, you can be a doctor, you can be an engineer, you can be an IT, you can take up different roles as a driver, as a chef, as an intelligence analyst. It depends what you really want to do. There are I think about over 200 roles that are available regardless of your gender.
Wow.
When I joined the army, it's not about race, color, caste. It's all about your abilities and your willingness to learn things. And I think the army is really, really good at that. And I think if I was to share an example, I wanted to get my second degree, and actually Army helped me to get my second degree in human resources, which I would have never thought of doing if it wasn't for them. And to be able to get a better job in a civilian world was another thing. If I hadn't done that degree through them, I wouldn't have found myself a better job and progressed.
That's actually amazing. I mean, you're right. There are so many misconceptions about the army, and I will admit, I have fallen for a lot of those misconceptions until I met you, and it really opened my eyes about the army. And a lot of the misconceptions are around, sexism, racism, and, obviously gender, which falls under sexism. How has it been for you, and what has your experience been as a woman, a brown woman in the army? Because, those misconceptions, when there's one thing that comes out in the media, whether that's to do with racism or sexism, it puts a lot of people off. And then that assumption comes in, just like with lots of other things. Oh, everyone's like that. The whole system is like that. And from what I hear, and after speaking with you, it's not really like that. And can you talk a bit about your experiences on that?
Yeah, my experiences have been amazing. And I haven't seen anything negative. So when I first joined, I wasn't a young person joining, so I was quite mature.
Yeah.
And I knew exactly what I wanted and why I'm joining.
Mm.
So I think it was, for me, it was quite nice to see what it's like being with other people from different backgrounds and understanding, and the willingness to learn.
Yeah.
And it wasn't just about me. I was there for learning. I was there to understand, how do I fit in this, and what do I bring to the table? What can I do for the army? And it's for my experiences have been incredible. And in fact, when I now go back and represent, every time I'm wearing uniform and I'm talking to people from my own community, and they ask me questions around what is it like, I haven't seen any. I can't give you an example where I felt different or I felt out of place. I have never had that experience. For me, it has been great. The unity, the teamwork is absolutely incredible. You wouldn't see that even in civilian jobs. So I've worked as a civil servant before. I worked in private sector and public sector. I haven't seen the teamwork that you get in the army. You will not find it anywhere else. That feeling of togetherness, that you will never leave someone behind, regardless of their strengths or weaknesses. You're always together as a team. Whatever you're doing it for one and only reason, is the mission that you've been given. And everyone works together. There's no, backstabbing, or there is no one being left behind.
Yeah.
We are there to serve our country. We are here to work together for our community, and we will do anything to the best of our ability to deliver that. And all the caste and the religion and the gender and everything is left behind. There is no such thing that I've seen. I'm sure people will have experiences and different experiences, but for me, it has always been exceptionally positive. It doesn't matter which rank I have spoken to or engaged with, which team I've worked with. I've always found it incredibly helpful, and I've learned things from different people from different regiments. So yeah, I will always say positive things about the army, because it's given so much to me.
Yeah, of course. I mean, what about the misconception with, well, I don't know if it's a misconception, but the idea of war, you join the army and you're set up to go to war. That's another thing as well. And I admit that would, that's the thought process I had as well.
Okay.
Again, before I met you and spoke to you.
Okay, I can only share my experience again. So when I joined, this was one of the things my friend said as well. Why are you joining? You're a single parent looking after 2 children. They will send you to a war. And that wasn't the case at all. So when I joined, Army understood what my role was as a single parent. They understood the people I worked with. It's not something that you join and then you're going to be sent away next, it's about training. It was about learning. Yes, you can put your name forward if you want to go in and go on deployments or do things. I mean, I've done a number of engagement events. I've been to US, Canada, and India. Last couple of years ago, we went through engagement. So we've done a number of things, and I've been to different places through training, our annual camps and so on. But it's not something they will push for. It's not something that first thing that comes to mind is, oh, you'll be sent to war. And I can see why it's a huge misconception.
Yeah.
Because I haven't seen that at all. It's about people. It's about how you're going to look after your people. And I think Army does that really well. They look after their soldiers really well.
Yeah.
And caring for your people, because those are the people who are going to run your business.
Yeah.
And it's all about looking after them and putting their needs. And of course, they understand what their mission is and what is expected of them. I think if I was asked a question, would I be ready to go? Yes, I'm ready anytime. I'm there to serve my country. And of course, yes. And the whole point is, yes, you should be ready. And that's why you're trained. You're trained so well up to a point, up to a level where you're ready to give yourself, and it's a commitment that you take on.
Yeah.
But that misconception that you send yes as soon as you train, goodbye, is not the case at all, I would say.
Yeah, of course. I mean, and it's great to know that. And I'm glad that we can talk through the misconceptions because, like I said, I had those, and I'm sure many people have those misconceptions, especially, women from different communities, different ethnic minority communities as well, whether you're Black, whether you're Asian. I feel like there aren't enough women from our background and the other ethnic minority backgrounds in the army. That's probably an issue, right? And what things are they doing to kind of try and recruit more women in general and from different ethnic minorities?
I think that becomes part of our role as well. So I work alongside the engagement team, and we go into the community and talk to people, talk to our people, whether we're going into temples, the gurdwaras, the church, and different areas that we cover, and got the whole engagement team that works throughout the country, and highlighting some of the work that we are doing. And it's about how, with new technology coming in, with artificial intelligence coming in, it's about what is there for you and why would you want to join. It's not that stigma that, okay, this is man's world and you're entering into a man's world and working together. And this is about raising awareness. When I go and speak to other women, it's all about learning from each other. A lot of our women also are generally quite shy and quiet, especially coming from our community, and they see their role as sometimes, once you're married, you're looking after children and looking after the family. You see that as a responsibility. But Army allows you to do this. Especially in my case, it has allowed me to do that. From where I've come from, I would have never, ever thought, if I was happily married, I would have never thought of joining. I probably would never be allowed to do so. But it's the awareness that I got through going through what I've gone through. Is life is not just about, living in one place and, just looking after the family. You have to look after yourself in order to look after other people.
Yeah.
And that's what we say, within other sectors as well, like NHS, with my secondary job. When you have to look after, you have to be sometimes selfish, look after yourself, and then you can look after other people. And especially as a mother, as a wife, as the pillar of that household, you've got to be in a stable condition, stable mind. If you look after yourself, you're fit and healthy, you will do a good job. And same thing applies to a soldier. If you're fit and healthy, you're going to do a good job. You're going to look after. So there are a number of things, there are a number of factors that are within it where, like I said, it's about raising awareness, and it's you have to like the sports for sure. If you like sports, Army is the place for you. If you like new technology, Army is the place for you. And come and explore. No one is forcing you to do anything. It's all about learning new things, joining the team, and seeing what can you get out of it, and what can you do for your country.
Yeah, I think that's probably the thing. The first step is probably to come and talk to someone in the Army, and find out what opportunities there are for you, or anyone listening that's thinking about it, and then making that decision. I know you also work for the NHS, and that's linked quite heavily to women's health. And I really would like to get into that quite a bit as well. Can you talk about your role in the NHS as well and what you do there?
Yeah, sure. So I work for Guy's and St Thomas's Hospital as Assistant General Manager there. And we cover a number of sites. So I started off with vaccination program where we were vaccinating during COVID, and we were quite busy then. And now we're focusing more around health inequalities in Southeast London. We've recently started this project called Proof of Concept. But before we got to that point, we were focusing around Vital 5. So during the COVID, when we were vaccinating our public or our people coming in, we asked them a question: when you come to the vaccination centre, what additional services would you like alongside vaccinations? And we got about 17,000 responses, and a lot of people said we would like to have kind of health checks where somebody could check our blood pressure, and somebody we could have conversation with. So we had different figures from there, and we needed to do something about that. We realized that there is a demand, there is a need. And we created, in partnership with King's Health Partners, we created this something called Vital 5 project. And Vital 5 project was all about healthy eating, stop smoking, safe drinking, blood pressure checks, obviously, which was the key theme, and then conversation around mental health. So we incorporated those within the vaccination program and also in our outreach. From there, we've decided to move on to something called proof of concept, where we want to do some work within Latin American communities and LGBT communities, because we want some engagement from those communities. And we know they're a bit hesitant when it comes to coming to NHS and talking about their health and well-being. So we want to go to them to raise awareness. And the first step when we think about anything is what comes to our mind is women. If we look after our women well, we will look after our society better, because like I said before, they're the pillars of the society, of the families. So if we look after them, that would be the best thing to do. So the project involves that we are going into the local mosques and churches in January and February to start with, and going and having those conversations around mental health, around healthy eating, how to be active, and so on, and promoting that health and well-being. So basically doing health and well-being checks to promote health and well-being generally, so we can encourage women to look after themselves first when it comes to it. Like I said, sometimes it's okay to be selfish, look after yourself first before you look after other people. So we're hoping with our new project, we will be able to raise awareness. We're hoping to take some specialists like a gynecologist who can talk about women's health. We would like to take some of our charity organizations to talk about conversations around domestic abuse, where there are problems or people needed guidance. We would also like to have conversations around, for example, weight management, how people can exercise and options that are available to them. And we're linking with a number of charities as well, where they can come and support us to talk about diabetes, for example, breast cancer awareness, all the issues that are so important to women, and especially from women from ethnic minorities who are really shy and don't talk about their weight, or don't want to talk about their bodies in general, don't like to talk about, for example, heavy periods, menopause. It's just a general thing that women don't like to talk about their health. But it's so important to look after yourself and to actually talk about it, because you could have similar problems somebody else could be going through. And again, you learn from each other. There's something called, I recently learned actually earlier in 2023, something called PPANs. And I had never heard of what are PPANs. So this sounds really, really strange. Basically, when you're, for example, on an exercise, I was drinking less and less water because I was worried that I would need to go to the toilet. And sometimes it's not very convenient when you're on a field exercise to go to a toilet pretty, imminently. And it was always a worry. So I was drinking less and less water, but the less water you drink, the less effective you are. So how do you avoid then to get into that situation? So somebody mentioned, oh, have you heard of PPANs? And I was like, oh, what are they? So you basically wear these PPANs, which are much more comfortable, and you're not worrying about what's happening, or if you're on heavy periods, for example. And it's so much easier. It's just completely changed my life. And now I want to talk about PPANs, which could be something very embarrassing, but it's an option I wasn't aware of. And a lot of girls maybe are not aware of it. And it's all about learning new things and sharing those new things that you learn. And I learned that through, the forum that we run for women in the British Army. Every year there's a topic that comes up, and this was a discussion, and I was quite amazed by this whole thing. Like, oh, I see, I didn't know that.
I think you're right. We do need to have more open discussions. I think there's so much taboo and there's so much shyness and quietness around so many women's health issues. And, that's from, examining your breasts to incontinence to heavy periods and menopause and perimenopause, all these things that women go through.
And suffer in silence.
Exactly. Suffering in silence. We don't talk about it enough publicly, openly, with our family, with friends, with just people. And when we do that, one, we're not learning. And secondly, we feel like when someone talks to you about it, you start kind of closing up and thinking, oh God, I don't want to, embarrassment, things like this.
Yeah, totally. And I think there are some topics that we are really embarrassed about talking openly.
Yeah.
And domestic abuse and isolation are two. So one of the work within the projects that we want to run, we want to highlight the concerns around isolation. So a lot of women who don't work and predominantly looking after their families or their children have reported that they suffer with isolation. And we want to run these groups for them to come out. And we want to run different topics and different subjects and for asking them to talk to people about or talk to the specialist about concerns that they might have.
Yeah.
It could be something very simple like a henna session. Let's sit together, let's do henna, or let's sit together and learn how to cook something new, a simple recipe which is healthy. Or, different things, or learn how to paint again, or something that is very simple, but let's get together, let's talk and bring a specialist in and then ask questions. If you're not comfortable talking about whatever the problem that you're suffering with, it's okay. Let's have one-to-one conversation.
Yeah.
But it's important to talk. The other thing is the embarrassment around abuse. People don't realize. 2.4 million people were reported to be abused or suffered domestic abuse in 2023 in England and Wales. And only 1.7 million were females. And women often don't report it. It takes somebody about 30 times before they will report it to the police. So clearly they're suffering in silence, and 1 in 4 women suffer domestic abuse from the age of 16 or above. So it's quite obvious that there is a problem, but we don't want to talk about it because it's not seen within our society as a conversation you have. And if you say I'm suffering with isolation or mental health, it's seen so negative and embarrassing within our society, especially South Asian communities. That, oh, you don't talk about this, you don't talk about your household problems, and you don't go and share it. Because it's again seen as embarrassment. Women who don't work, are just so hidden and so isolated. And I think raising that awareness around how important it is for you to actually work, because it gives you that mental stimulation where you go and meet people, you have that little social life, and you become financially independent. That's another thing that is so important, whether you work part-time or full-time. It's really important that you work to have that ability, one, to be able to make your own decisions and be able to have a stand, whether it's in the society or whether it's in the household. And you're able to speak to other people and you're able to learn and raise awareness with others. I think I've covered quite a lot within the subject, but it's really important that you don't suffer in silence and you ask for help. When I was going through it personally, I didn't know there was anything available. I didn't know who to speak to, and I was homeless. And I remember sleeping in my car for a number of nights until I found somewhere to live. And that time was the most scariest time of my life. I had no hope, and my family had turned their back on me. I didn't know who to go and talk to, and I would hate to see anyone go through that. Nobody should go through that. And it's because I wasn't allowed to work when I was married. And if I was allowed to work, I would have known my rights a bit better. I think this is where raising awareness is so important around women. And there is no need to suffer in silence. There is no need to cope with this on your own. There are a number of charities, there are a number of organizations. You can go and have a conversation, whether it's through your doctor, your midwife, your nurse, or a trusted friend, and go and speak to someone. There is no need to suffer.
Yeah, and I will
join the British Army as well. Make a team.
Absolutely, for sure. Actually, after speaking with you and learning all about it, I've said to my daughter, "Have you considered joining the army?"
Oh, that's fantastic.
And straight up, she said, "No, I'm not doing that." And I said, "Look, don't underestimate it. I've learned quite a lot about it, and the things I never knew, and I think it's worth exploring. You don't have to do anything, but it's definitely worth exploring." And I think I would have hoped, if I was a lot younger, I know I'm not saying I can't do it now. I mean, I'm in my 40s, but I'm sure women in their 40s, 30s, 20s, doesn't matter what age, like you joined when you were a bit older. There's huge advantages of it, for sure.
Sorry, I was going to say, the opportunities that I've had, I would have not had that in my civilian life. I've learned to ski. I go on ski trips with the Army, and I get paid for it. I've learned new systems. I've learned how to operate weapon systems, different ones, and just generally dealing with the challenges of life is incredible. I never thought I could do that. I never thought in my wildest of my dreams that I would ever join. And it's the hardest thing I've done physically and mentally.
Yeah.
And that's the truth. It's not easy, but it's every weekend you come back, every time you have done, worked in a team, or you've done a project, or you've been on an exercise, you come back and you think, oh my God, I can't believe I've done that. And it's that sense of achievement and a sense of belonging that you get is incredible. And the opportunities, again, going to different countries. And I've been to number 10 a couple of times. I've been lucky enough, and being to House of Commons. And again, it's all about options and opportunities that you need to open up for yourself and see what the world is like, what it can give you, and you can only do it through your hard work and through your dedication, and not giving up, because it's sometimes it's quite easy to give up and come home and say, no, it's fine. But it's carrying on. Just don't give up, carry on, push yourself as much as you possibly can. And that willingness and ability to do it will change your life forever.
That's great. So I will be adding details of the Army and some links for people that might need help with lots of areas, whether that's domestic abuse. You said there's lots of help out there, so I will get the links off you and add them in the show notes, so people, if they, if anyone's listening, any women listening, and they do want help, or they do want to find out a bit more about the Army, whatever that may be, they can go to that. I have a couple of more questions. I'm all about collaboration, and are there any opportunities that you're looking for right now, whether that's on a personal level or related to the Army or NHS, that you could be connected to right now?
I definitely am looking to make more connections within Southeast London, and through the work with the Army as well, through the veteran groups, a lot of women who have left, or veterans generally, from LGBT community. I'm looking to do more work around those, and helping women to emphasize and raise awareness around what help they need, or what we as an organization can do. Both British Army and the NHS can support veterans and people from LGBT community, and that's what I'm emphasizing on as a next step. And that would be my goal for 2024, to look after women's health and do a lot more within the veteran community as well.
That's great. And what empowering advice would you give to women that are seeking help or any kind of advice if they're in any situation related to abuse?
I would strongly say talk to someone you trust, or go and speak to a specialist. There is help out there. You don't need to suffer in silence. Be strong. And it doesn't matter if you do something in terms of your physical health, whether it's going for a walk or whether it's exercising, but you got to look after yourself mentally and physically to deal with any challenges that are going to come your way. Because if you're strong, you can deal with the problems. And there is always help out there. It's just reaching out. Reaching out is the key. And staying strong physically and mentally will get you through that problem. You might see a dark room now, but it will bring some light in for sure.
Thanks so much. Like I said, I'll put all the links in the show notes. So if anyone wants to have a look and reach out on there, they can do so. Manpreet, thank you so much for being on the Empower Her podcast. It's been an absolute pleasure to have you on. Thank you.
Thank you. Thank you so much.
Thanks for tuning in to Empower Her. I hope today's episode has left you feeling inspired and motivated to make a positive difference in your world. Please follow the podcast and share it with anyone who will find it helpful. Until next time, keep striving for positive change and greatness for all women.